Hello, I am Dr. Amit, dermatologist, New Delhi. Welcome to Health Dialogues. Vitiligo, leukoderma, fulvari. These are the words which come to your mind when you see a white patch on somebody's skin. What is vitiligo? Vitiligo is basically a skin disease, maybe an autoimmune disorder, which way the color of the skin changes on any part of the body. It can involve any part of the skin. It can involve the hair, it can involve the mucous membranes, it can involve your oral cavity, nose, and even genitalia. What happens in a vitiligo? In vitiligo, the cells producing the melanin, the melanocytes, get destroyed, or they stop producing the pigment melanin which gives color to our skin and hair and nails. Why does this destruction happen? It can be because of an autoimmune disorder, self-destruction. It can be because of heredity, which can be seen up to 33% of patients which already have a long family history of vitiligo. It can even happen with chemicals, sudden burns, and even a stress factor can even lead to sudden form of white patches. So how does vitiligo present? It presents with a change of color or white in any part of the skin, in hair, eyebrows, eyelashes, inside the coating of the oral cavity and nose and genitalia, and even in the eyes. What are different types of vitiligo you get to see? Vitiligo can be universal vitiligo where almost the entire skin is involved. One can be generalized vitiligo where you see usually symmetrical where both sides of the body is involved and is progressing or stationary. Segmental vitiligo. Segmental vitiligo basically is seen on one side of the body and usually seen in early age group, and it happens once and becomes stationary. Focal or localized vitiligo, you will see a single patch on any part of the body and it will keep on persisting in that way. Acrofacial. Acrofacial vitiligo basically means extremities vitiligo where you get to see the lips, the hands and the feet usually. What complications you get to see in vitiligo? Basically, vitiligo is not a life-threatening disease. It's more of a cosmetic disease. But patches where we get vitiligo or the white patches, the melanin pigment is not existing there. So, those patches become more prone to sunburn than tanning. In eyes, retina, the back part of the most sensitive part of the eye, there can be different color changes. Even the iris, which provides color to our eyes, changes can be seen. But basically, it is more of a cosmetic disease. So how do we diagnose vitiligo? Vitiligo is basically diagnosed in a clinically way, but for a confirmation of the thing, we can use Wood's lamp, which emits UV light to see the color of the patch. How do we basically differentiate from other white patches conditions? Example, we get to see a lot of chemical burns like industrial burns, a lot of chemicals coming in direct contact with the skin such as bindi, kumkum, a lot of cosmetics, and very commonly seen in footwear, in resins and rubbers which contains MHB, which causes pigmentation of the skin. How do we differentiate from vitiligo? Usually chemical burns will be disfigured and blotchy type of white patches. So you can be very well defined from vitiligo. Other conditions which we see similar patches is pityriasis versicolor or tinea versicolor. It's a fungal infection where the yeast slowly changes the color of the skin to various colors. That's called versicolor. And usually in dark color skin, we get to see more of white patches. And how do we diagnose it differently from vitiligo? We do a scraping test for fungal to detect whether it is present or not. Albinism. Albinism you will see usually because of loss is a hereditary condition. From birth you will see total or complete loss of color, even in hair, skin, eyes. It's more of a genetic disorder. Pityriasis alba. Pityriasis alba is well-defined patches usually seen on the face and even on the body, and again mostly common in children. The causes have been given into worm infestation or nutritional deficiency. So that has to be also differentiated from vitiligo. How do we approach a patient of vitiligo? Basically, vitiligo is considered being an autoimmune disorder. We should investigate for other autoimmune disorders like hypothyroidism, diabetes, Addisonian disease, just to rule out association with other autoimmune disorders. Then the baseline investigation should be done, and other deficiencies like vitamin B12, vitamin D, iron, ferritin should be always done. How do we treat vitiligo? Vitiligo treatment has two aspects. Repigmentation, the patches, we try to get back the color on the patches. Depigmentation. Depigmentation basically is a little aggressive treatment where most of the body parts are involved with vitiligo patches, and the patient prefers the remaining normal skin color patches to be depigmented so that it matches completely with the white patches. So that is usually done with monobenzone chemical, which is available in creams to depigment those patches. Coming back to repigmentation. Repigmentation treatment has both topical, oral, as well as UV light therapy. So starting with topical, mild topical steroids can be used, but cautiously, because long-term steroid use can cause thinning of skin, stretch marks as well, and increased sensitivity of the skin. Oral steroids. Oral steroids called mini pulse can be given in low doses, but again, oral steroids have their own side effects like diabetes, increased weight, Cushing-Coat syndrome, premature cataract. So that also has to be monitored, especially in children, especially in age-growing children where the bone deformities can occur, early fusion of the bones can happen because of steroids. Then vitamin D analogs can also be used for topical creams, and immunomodulators like tacrolimus and picrolimus have been also tried. Now, coming to UV light therapy. UV light therapy or the natural sunlight has been a long old age treatment which now being used inside OPDs, such as narrow band UVB light is used for repigmentation of the patches. Now UVB chambers are available. Even excimer laser, which uses the narrow UVB band, can also be used, but excimer laser can be only used for small areas as it has a narrow focus. For a generalized, UVB light can be used. Nowadays, even PUVA therapy, that is oral surveillance with UVA light, has also been promoted for mostly exposed parts of the body. Now, other therapies coming to surgical, where we can do camouflage. In camouflage therapy, a simple makeup can also help us to hide the patches. We should be using sunscreen, especially on the exposed parts of vitiligo, so that there is not a major contrast between the white patches and the normal skin. Tattooing. Tattooing is usually recommended for lips where the repigmentation is required. Coming to skin grafting. Skin grafting has been recommended for patches, especially for small patches, but the side effects is again depigmentation, scarring and infection. So it should not be done on dependent parts of the body, especially like feet, and it's very good recommended on the face, on the hands for the grafts. Vitiligo being mostly a psychological disease and a depressing disease, a patient suffering from vitiligo should regularly go for counseling sessions and advising to emulate basically the patient to increase the confidence of the patient because it's being a cosmetic disease and a taboo still in our country. People have a different perspective towards the disease. So people who are feeling low about the disease, low about the society, should definitely go for counseling sessions to boost their mind. Thank you.